Hello, all. We are going to just wait one more minute to have some folks be able to come on onto the line. So just, if you need to go grab a drink or something, you still have a minute to do that. All right, we're just gonna wait like 30 more seconds. Yeah, we still have a few folks rolling in on the attendee side. Feel free to, if you wish, and have the chat access. Um, oh, sorry. I was thinking my our other speaker had just texted me. Um, yeah, yes. Okay, sorry. Now I can. Um, we are able to get going here. I just want to make sure we have everything set. All right, great. Welcome. Thank you all for being on time to this month's Be Informed session. This I normally start a few minutes after, and I guess we are already two after, so we'll just proceed. Um, so this is in webinar format, so attendees will start on mute, and if you want to chat, and we actually highly encourage you chat, please introduce yourself in the chat with your name, preferred pronouns, and the organization you're with. I'm Frank Hood, he, him, and I'm with the Hepatitis B Foundation. I'm their Associate Director of Policy and Partnerships. I am also the director of the national coalition they co-lead, Hep B United, and it is that coalition that is putting on this session today. We will have a Q&A towards the end of the session. So please do submit your questions in the Q&A box or in the chat. And feel free to submit them just whenever you think of them. You don't feel like you have to wait until the end, because we may be able to answer it as we speak. And we can also just make sure we have an idea of what we might need to tackle and how much time we might need to leave for Q&A if we see that there's a bunch that are coming in. So if this is your first session with us, or first time being at a Hep B United activity, welcome, thank you. Hep B United is a national coalition. We now have, this is actually should say 60 plus, we've now passed 60, local national organizations across 38 cities and 28 states and DC. We are constantly growing, so keeping it up to date is sometimes tough. We call ourselves a coalition of coalitions, as we are a national coalition focused on helping state and local coalitions and others doing the work on hepatitis B. We say doing the work on Hep B broadly because really it is a broad group that is doing the necessary work of tackling hepatitis B on the ground. So this can be organizations like the Asian Health Coalition that are focused specifically on Asian health and recognize that hepatitis B disparately impacts that community. Or it can be something like an FQHC or other community health center that is looking at a specific city and just in the midst of doing other their other public health work, decide to stand up a hepatitis B specific piece. We are always looking for new members to support. So please, if you are doing hepatitis B work and you're not a member of Hep B United, please reach out to my colleague Shreya, who's also on, or myself, and we will happily get you the sheet you need to fill out. It doesn't cost anything to join. We're primarily CDC funded, so we're part of the public health system and really here to provide technical assistance and other capacity building. Just taking a look at my attendees to make sure there's no one I need to. Okay, great. Excuse me. I'm in the midst of losing my voice, so this will be a fun little bit. So, what is the Be Informed series? This is a series that this month is celebrating 2 years of existence. So, yay, go us! It is a echo style format in that we tend to have a didactic speaker and then have a case study that sort of backs up and shows a real world example of something that the speaker has talked about. We actually aren't following that format for today, and I'll get into that in just a moment. But really, we heard from our partners and others that use our resources that they would love for a deep dive like Echo gives, but geared more towards their non-clinician selves, because the echoes tend to be very clinician focused, and we have a lot of partners who are community health workers in just other capacities. So we host this every other month on the third Tuesday of the month. They tend to be 45 minutes long, although we are willing to go later if we're on a good roll with Q&A or things like that. And we do ask that you please fill out the post of the evaluation. When you close out, it should pop up with some just a couple questions. That really helps us ensure that we are looking at the right items, as well as excuse me, just that helps us ensure that we're looking at the right items. And some of the deliverables that we have to go and report back to CDC include how many folks showed up, but also kind of what you all tell us on your kind of post-test evaluation. So that's the coalition and our session. And I'm going to get us introduced to what today's session is going to be about. So we today are going to look at a new tool that Hep B United is putting out. This is a self-assessment tool for community health organizations. And this is something that has been a labor of love for a better part of 4 years now. And I'm joined here by Dr. Chioma Naji, who was our health equity work group leader. And I am super thrilled to be sharing this space with her today because she is one of my health equity heroes, and I'm not ashamed to say it. I've been doing public health work for more than a decade, and all that, a lot of that time really focused on health equity. And I don't want to say I thought I knew a lot, but I didn't realize how much I didn't know. And not only is Chioma just a fantastic teacher, but there was a presentation she gave about 5 years ago, along with one of our other work group members, Blatma Natiri Reed. It was on a Hep B United virtual summit during COVID, before I had ever joined, and made me just open my eyes to implicit biases in a way that I had just never framed before, and it blew my mind. And then to come here and then be able to get to work with her and then on this specific project is amazing, and I'm really thrilled today. And Shioma's doing double duty right now at another event as well, but has thankfully given us some time to pop on. And then if there are any questions that I'm not able to answer, but that she might, I will make sure she gets them during our Q&A. Hey, Chioma. So I actually, thank you for coming on camera. We are running a couple minutes ahead, so I'm actually okay. If you're ready, I'm good to pass it over to you. Awesome. So Shimo's going to talk a little bit about kind of what happened, how we came to be around this tool, and then I'll dive through the tool specifically. But it is my great honor to welcome Dr. Chioma Naji to talk about our self-assessment tool for community health organizations. Take it away, Chioma.
Thank you, Frank. I assure everybody I did not pay him to say all those amazing things. I really appreciate it. It lets me know that something's going right, right? It's always good to to hear that something that you're doing is going right. So thank you again, Frank, for those words. So I had the opportunity to work with Hep B Foundation on this amazing project, and it definitely was a labor of love, is a labor of love. And so I'm going to talk a little bit about our process, and then Frank will give you the details of the actual tool that was created. So next slide. So Hep B Foundation asked me to come on and really support them to think about how they can integrate more health equity into their work. And not only their work, but the work that they do with their grantees and their partners. And so part of that conversation was, so what do you want to do? And they were what I appreciated about this, the beginning of this project is that they were willing to be reflective in this process, right? And so they were like, well, let's bring some folks together who know Hep B Foundation, who know the work that we do, to answer the question on what is it that we want to do. And so we actually got into a very dynamic process, and it was very participatory. It was very reflective, and not only what the tool ended up being, but even the fact that we developed this tool. And so what first happened was that we brought a group of about 10 to 12 people together who were representative of various people who do hepatitis B, HIV, and other related work, from community-based folks also to folks who sit at national organizations, and also folks who sit in diverse organizations. And so we came together to answer this question on what is it that we should be doing. And so the group said, well, first, let us hear from Hep B Foundation on all the work that they were doing, right? And so we had several presentations by Hep B, and the internal team really gave great information around not just the overall organization, but also specifically the capacity building and technical assistant work that they were doing. And so then with this advisory group, we had some engaging interactive sessions to determine, okay, what is the area of focus? What's the area that we want to really dive deep in? And then we could figure out what is that actual deliverable. And then we decided to gather additional feedback from diverse individuals and organizations, still answering this question on sort of what is it that is needed. And we had the opportunity to do some work, some workshops at the virtual 2022 mini summit that happened. And that yielded to the deliverable that we came up with, which is an assessment tool that you're going to see. And then actually the health equity work group, the advisory group, came together and started developing the purpose. Now, what I forgot to mention is when we were talking about determining the area of focus, we actually decided that we wanted to focus on stigma and discrimination, right? Because we felt like, one, that's a big issue. It's a complex issue. And then also requires us to focus on a structural intervention that is based at the organizational level versus always what we see often, right, in our work is that this focus on the individual level, right? So if we're really talking about health equity work, we're moving away from the individual and talking about what are the systems, the processes, the policies that are in place that are harmful and that continue to perpetuate vulnerability for certain populations, right? And so we knew we wanted to focus on stigma and discrimination. Next slide. And so once I think this is the information shared in a different way, but once we decided on the purpose, we actually ended up doing some internal work using a shared Google document, right? Like old school, right? Like some of this stuff you can't avoid getting into the manual work of it. And so we created a Google document. And we came up with these areas and these categories that we wanted to focus on as it relates to this tool. Now the reason why the tool was selected was because Hep B Foundation was really like, well, it would be great for us to think about stigma and discrimination how we minimize stigma and discrimination within our own programming when we do capacity building and technical assistance, right? So how are we making sure that we're not falling into some of these harmful practices that lead to, again, continuing to marginalize populations? And how are we doing that in ways in which we are supporting our grantees to also not do that? And so one of the opportunities was really thinking about, okay, how are you assessing your own programming around and thinking about in this sort of focus area of stigma and discrimination? How are you assessing your own programming? And so we definitely knew that we didn't want a tool that was going to be punitive, right? Because those aren't helpful, right? Check mark, Xbox, like that's not helpful, right? We wanted a tool that was going to be informative and allow for folks to interact with content that they can actually reflect on and then think about what are some solutions that we can do to address it. And because this was not only going to be used for Hep B Foundation, but also for grantees, how can we make the tool flexible enough that any organization can use it, right? According to what are some of the capacity building and technical assistance services that they provide. Next slide. And so this was our sort of very clear purpose for the tool. To develop a tool that can effectively assess the extent of equitable approaches used by Hep B United's capacity building program. The tool should be able to identify specific areas where the program can improve to become more equitable and inclusive, right? And so with this guiding framework, with this guiding purpose, we came up with about 10 areas for the sort of assessment of programs, and then within each area, ways in which you need to be thinking about or questions to sort of think about in identifying or assessing your program in terms of it being sort of equitable or using equitable approaches. So I think I'm gonna hang it over to you, Frank, to give the details. Oh,
Yeah.
no.
No, I was like, you have
Okay.
your one
Yes.
last one.
Okay. Okay. Well, this was the question that we posed to come up with those, I think, areas, right? So, what is critical to assess to ensure that the training capacity building program embodies equity principles in all aspects of planning, implementation, and monitoring. So that's a good point. So the tool, we wanted to make sure that the tool focused on the full continuum of a program, right? And so from the point at which a capacity building program is being planned and developed to the point at which it's being implemented and to the point that it's being evaluated or monitoring, right? So we know that evaluation should be an ongoing process, not just something that is at the end in terms of outcome. So this guiding question helped us sort of look out at these key areas that now Frank is going to talk more about. Thank you.
Yeah, thank you, Chioma. And really, as Chioma said, when we kind of came together, it wasn't like, all right, we want to do a tool. It was, we have this amazing opportunity and have some resources to bring together a group of experts in the field of health equity to actually ensure we're doing this work equitably. Like that was the charge, and it was very much an internal focus. And Chioma was just so great to get us to like keep that broad lens and really keep it broad instead of just being like falling down a specific rabbit hole, like one thing will save us all. And I really appreciated that. And it really, because we kept it broad, and we had intended for this to be an internal tool or an internal thing. Once it became a tool and we realized it didn't have to be internal, that we could make it flexible enough that our partners could use it too, then that's kind of where we went forward. And so we were hoping to create magic to make ourselves better. And I think we were able to do that, but we were also able to like bottle it and be able to share it. And so that's what I'm most excited about is like, we were trying to do this to help our programs and our grantees by being better ourselves. And I think we've landed in a place where we're able to get better ourselves and show them like what we did and have them do it themselves. And Chioma, I know that you are doing double duty, so anytime you have to pop off, go right ahead. But I will move us forward, and feel free to jump in and interrupt us. But yes, we had 10 great work group members listed here. I'm sure many of you will recognize many of these names. They're all badasses in their own right. Put them together into a room and set them forward on a problem. Oof, you're going to get results, and that's exactly what we did. So a massive thank you to each and every one of them who spent countless hours with us as a group, and with Shreya and I individually as we like peppered them with a bunch of questions in through our interview guides. I will share with you the link to the document in just a moment, but I also know that when you set something in front of someone, they go and look at it and to pay attention to you. So I'm going to hold off for just a moment. Uh, so we built this tool that we built. It is intended, it's about 20 pages long, and that sounds big, but it's actually quite short. We could have got a lot longer. It looks at 11 domains. And so basically we took the kind of the aspects of a community health program or organization and put it into 11 buckets. And then from there, kind of asked, what are the questions you have to ask yourself or your program uh, in each of these buckets. And so we ended up with 52 total questions. And then from there, we give, we say, okay, like this is the question you've asked yourself under this bucket. Or have you accomplished this? Have you figured it out? Are you in the process of figuring out, or are you just like you totally don't know? So that's where accomplished, established, developing, undeveloped comes in. But we didn't just want to be like, well, what do you think? We wanted to make sure that you had a guiding example. And so each one of these attributes for each one of these four kind of outcomes has an example. So really, when you look at it, like we had to come up with like 208 kind of framings of if you're, success or not success. And so that took some time. We also, though, when thinking about how you're able to apply this, you realize that words mean different things to different people, and words very much require context. I can say the word community, and in the sense of me being a human on this earth, that means one thing. As a sense of being a Marylander, that means something different. As a sense of being a happy advocate, that means something totally different as well. And so if we're going to go and ask ourselves or others to really look at and solve or ensure they're doing the right thing, we also have to make sure that they can clearly define certain terms. And so when we go past this example, it'll be a little bit easier to see, but within each of our attributes, when we kind of say like, uh, you know, have folks from the community as part of our leadership board, community is highlighted, and we make you go and define what you mean by community, and that definition lasts throughout the entire tool. So there, as you're going through it, you're not only just looking at your programs and if you think it's being it's fitting into a certain category or not, you're also specifically defining what these certain terms mean as it relates to your organization. And given that this is supposed to be something that you can kind of use over and over, it'll be interesting to see that after you run one of these before a program, you have it listed a certain way. You run your program, you do like a post evaluation using this tool. Maybe your definitions have changed, and so there's a couple different ways you can use this tool to really kind of define your programming. In term using language that Chioma just used, so we were trying not to be punitive, and I think that was a really great phrasing of that. Thank you, Chioma. And so we do have an overall score for each domain, like a 1 being exceptional, a 9 being poor. But that's for you to sort of be able to like, okay, if I had to like really give this whole section kind of a grade, what would it, where would I put it at? And that's just to help you to be able to maybe compare yourselves a little bit over different domains, but you don't ever actually go and score at the end. Like it's not like we ask you to go and tally it up. That's not the purpose. We're not trying to get it down to one number. One number does not rule us all. No, it is for you to be able to see like, oh man, I actually like really, I'm surprised that I am doing so well over here and not as well over there. So this is an example of what one will look like, and then analyze results for improvement. It really is just you go back through and it's, what did you put as developing or undeveloped that you want to see move higher? Maybe there's something that you thought you would be accomplished on, and now you realize you're actually just established on, and you in fact want to make that movement from established to accomplished. Maybe you had a hard time defining a term, and you're like, maybe we shouldn't have a hard time defining that term. And so you take the time you need to like really make sure you have a clear understanding or a clear definition. So we've talked a lot about domains. It took a long time to figure out what these domains are, but the 11 that we've ended up with, these are 6. I'll show the other 5. So we've defined each of the domain. So we tell you like what it is we're sort of describing, and then within it, there'll be certain terms, like I said, community, that you'll define yourself. But when we talk about leadership team, we're really saying authority over hiring, firing, budget, decision making, which could be different than staff and facilitators. Which if you're looking at this for a program, one of your staff people might be the person running it, but they still have a leadership that they have to answer to. So your leadership team, staff and facilitators, we have you look at your materials and resources, both written and verbal. And specifically, we're saying, the items that you're using to support a program's goals. And so it's usually the documents you make or one-pagers, things like that. Accessibility and recruitment, where are you finding your people? Are you ensuring that everyone's able to come in? And are you considering like the full broad array of folks that might be wanting to use your program? Pedagogy really is looking at like a lot of our work is awareness raising or educating others. How did you come up with the system you're using in order to educate others? Feedback from grantees and partners. This tool is about like self-assessment, self-feedback, but you really, the best organizations, the best programs we've seen are ones that really are ensuring they're hearing from partners, hearing from grantees, and adjusting as needed to meet the needs of those grantees and partners. Our last 5, so this first one on this last 5, I show love because it's like the je ne sais quoi, like the ennui of a program, you're sort of like distilling it and defining it is great. So the morale, connectedness, and culture. We talk about organizations that can be great, but they have a really bad culture, but it doesn't show up on a financial report. So this self-assessment tool really does makes you kind of look at your culture, and hopefully you're honest with that. Monitoring and evaluation. This is different than like getting feedback. This is actually, how are you tracking your information? Is it using best practice, things like that? Grant making process and protocols. This was one of our, I think, touchiest ones because money is always interesting and not interesting. Money is always touchy, and there's a lot of there are a lot of structural barriers already built into financial giving. And we were very, very fortunate to that Sadius Pham, who is on our advisory group, was able to point to some other tools that had actually done a really good job defining grant making process and protocols in a health equity sense. And that really helped us unstick a few things. And so really thrilled about what kind of was a sticking point ended up being, I think, a strength of this tool. Compensation, which is different than grant making. This is how you're actually paying folks. And then lastly is resource allocation. So getting and giving money is different than paying people money, which is different than how you're dividing up staffing versus resource like printing, incentives, etc. Oh, no, sorry. I need to stop sharing my screen here and then show you the actual tool. Okay, so if you want to find it, I'll lead you all on a journey. Come with me. So if you want to find it, so go to our Hep B United website, and we will have a link dropped into the chat directly to it, but it'll be under resources. Go to our resource repository, and then under topic, like I said, we'll have a link directly to it, but just if you're trying to show other folks. And then under community engagement, so a lot of our community organization tools are in here, including this one. And so it's the very first one, and then English. We'll click into it. So this is a PDF. It is printable. Let me clear up some of this and make it a little bit closer for you. You'll see, all of this text here really is what Chioma and I have just said out loud. So we, and then we've gone through and kind of talked through each of the steps, and I just did that as well. So we do have a example that was the pullout I had on the slide, but that does exist in the guide. And then we get into the first domain. So here under program, we're intending you to write like what it is you are looking at. So I might say Hep B United mini grant programs. And then from there, that is my overarch framing. Um, so domain one is leadership team. The definitions that I had on that last slide are in each of the domains. So that is clearly laid out. And then it goes into each of those attributes. And there's not an equal number of attributes per domain. Some domains have more than others just based on what needed to be discussed. But you'll see here the blue highlight. So anytime we have a blue highlight, that is saying that we need you to define specifically who that is. So we say, like, we're saying that the leadership team are these individuals. Does the leadership team, like, who is your leadership team? And we'll see down here, like under the next page, the terms to define. So who specifically, name or title, are the individuals with authority over this program, staff, facilitators, budget, and implementation decisions? Up here again, we have the familiarity. So you're defining familiarity, like how are they knowledgeable about the community being served? And we give some examples. Like this is not trying to be a gotcha experience. This is very much trying to be like, this is what we mean. Kind of put them here and look at them. And then lastly, we say community. And then I have it communities. And then like, what are the program targets? It could be racial, ethnic, like organizational, clinical, just, what is your community? So you'll see though, there's a lot of blue highlights, except once you define leadership team, that meaning of leadership team stays the same throughout. So you might need to go back and adjust it later on. You might realize like, oh man, I actually should have included so-and-so. And you go back up to here and you put in that person and you kind of go back through it, but that's okay. Like the goal of it was for you to be able to kind of put to paper all the different aspects of your program under these different kind of pieces. And so anytime that leadership team familiarity or community are going to pop up anytime throughout, it's going to be the same thing. And you could actually like, kind of just pull it forward. And then like I said, we go through and give an example. We feel, or like, an accomplished leadership team would have extensive knowledge. An undeveloped leadership team would not have familiarity and isn't trying to develop it. But you could have a leadership team who like doesn't have any experience, but they know that and they're like working on it. And that could be something that's developing. The goal of this really is, it's a self-assessment. So you got to be true to yourself. Don't be hard on yourself. Just be true to yourself because hiding, like trying to like, mind game yourself to be like, oh no, we're actually accomplished on that isn't actually going to serve the purpose this is trying to serve, which is where can you improve? Where might resources be able to move forward? So this is domain one. And each one of these, you go through, you ask the question, you define your things, you sort of pick where you are for each of this, and then it's like, are members of the community part of the leadership team? You go through, you pick which one, and you do it for each one of these 52 instances. And then here at the end, you look at your whole thing. You might see like you have a lot over on this column, and you're like, I'm not feeling very exceptional. I don't think I'm poor, but I might be a 6 or a 7, and you just put it there in the little green box, and then you move on to the next one. So the other reason why we have these highlighted in order to define is that it allows the flexibility of this being able to be used at the beginning of a program, maybe looking at the middle of a program, maybe looking at the end of the program. So by having the ability to define what it is you're looking at, you're also able to kind of tailor it to post program eval versus pre-program eval. So staff and facilitator team, you'll see just 4. Community, it'll say, hey, you've already defined this. Go back, look up there. So you'll see that, but we still pull it out just because we want you to make sure that you're thinking of community in that way. So same process, and I'm just gonna kind of scroll back through here, just kind of through it, so you have a way to know what it looks like, and I'm gonna open up for Q&A, just so folks can ask their questions. Here we'll see under materials, we got a little bit more into the weeds on defining things, but that is because we're talking about we're looking at how you're getting things out. You're looking at how you're deciding if your program or your materials are working. And then when you're talking about if a material is representative of the community it's intended for, like representative means a lot. And so really taking the time to ensure that is happening is important. Accessibility and recruitment, and just, yeah, really just going through here to show that you really could get a better understanding about the accessibility and recruitment of your program by asking 5 questions. Like that's another way to think about this is like, hey, for just 5 questions, you can improve the accessibility and recruitment of your program. So I'll just keep scrolling through here to kind of give you the sense of like how workable this is. You're asking the questions, you're defining it, we're helping you define it. Um, and really just it is something that is intended for you to print, circle, write on, make notes, and then go and do with what you will. But
But can I
it is a
offer,
self-service tool. Yeah, I was
can I,
about to actually open this up to Q&A, so go for it.
yeah, if I can just offer also, what I appreciate about the tool is it could be an independent exercise, but it also can be a team exercise, right? It could be a way for you to bring your team together on the same page about your program, right? And so it could be done, in groups, small groups, 2 to 3 members of your team, and then you all compare, like, oh, what did each one of us sort of really think about the program? And it might give you a more realistic, based on different people's perceptions, based on people's position within the program, what the work that they do within the program. So I think it can be a very dynamic tool used to examine programs. Yeah.
Yeah, very much so. So yes, we usually have these go 45 minutes. So we have 10 more minutes. No one's asked a question yet though. So if you have a question, please do submit it in the chat. Because we would love to answer. To your point, Shoma, what's interesting about this is, programs mean a lot of different things, and so, the mini grants program, or actually, no, the Be Informed Sessions is a capacity building program within Hep B United, but Hep B
Mhm.
United's technically kind of a program of the Hepatitis B Foundation. Like we are,
Mhm.
we have our own things happening within the foundation. There are other things happening within the foundation, and so you could look at the entirety of HBU using this tool, or each one of our programs could have that. And that really that scalability is because we're sort of putting in the framework and you're defining specifically the areas that
Mhm.
need to get defined. Like we picked out what is the scalability on it, and then you get to kind of like set the scale.
Mhm. Yeah. Yeah, I mean, and I think being able just to say to folks like take this and apply it to your program or your organization in a way that makes sense is a way I think and then give feedback, right? Because we acknowledge that this tool has not been piloted, right? It hasn't
Yep.
gone through some type of evaluation in itself, and so people being able to use it and giving Hep B Foundation feedback as a way to better the tool, and really make sure that the tool should be able to evolve based on how people are using it.
That I appreciate you flagging that. And that is something I wanted to make sure that got mentioned is that we intend this to be a living document.
Mhm.
That we got smart people in a room and we spent a lot of years and we got to this point, but that's not to say we have a monopoly on good ideas. And when this gets the best laid plan can immediately go awry when applied to the real world, especially with a real world that looks like ours right now. So, if
Mhm.
there are pieces of this that like, we totally missed something on, or, should we be asking other questions or additional questions, like, let us know. We're not going to be offended. In fact, we'll be thrilled that you used it and had we're able to use it enough to be like, I think it's missing this. So please do let us know. If you have a question, please do put it in the Q&A. The Oh, yeah. I was anticipating questions. Sorry, I usually have like a few stock ones I can use. Um, Shioma, I
But,
will ask.
oh, mhm.
Oh, do
No,
we
go
have
ahead,
one?
Frank. I had a
Oh, I
question.
was so you do a lot of organization transformation work and really do have a focus on like individual and cultural and organizational equity and culture shift. I am curious, outside of like a self-assessment like this, what are other things organizations should maybe be considering doing or looking at if they're looking to improve their health equity, their program's health equity work, or even their personal health equity work?
Yeah. I mean, one of the things I've really been preaching, given sort of the times that we're in, is finding ways to be in community. I just came back from an amazing conference that, I feel like if I wasn't there, I would have missed out on a lot of things, right?
Oh,
And so one of the things about doing this health equity work, is being able to find sort of like-minded folks that you can be in community and you can really sort of say like these are all the issues and get some new ideas and even get sort of more motivated to do the work because it can be draining, knowing sort of what we're dealing with now in public health is can be overwhelming, and so being able to be in community to create moments of reflection, to continue to grow and increase your own knowledge, and then also to just get more motivated to continue to do the work. So that's one thing I would say as individuals or organizations in this work. I think the other thing is that we cannot uh, forget about sort of the importance of trainings. Trainings are important, right? And so staying up to date on some of the new ideas, even the new language that is coming out around equity work, right? Language is always evolving, especially when we talk about language with particular populations. And so being able to put yourself in a space of always learning through trainings, I think is a key piece for an individual or organization um, to do, you know?
thank you for that.
Mhm.
And as I realized I asked you a question, but then also had said earlier that I had my own sort of personal transformation off of something you had presented on, and realized there's video evidence of this. So in the
Oh my
chat,
God, Frank.
in the chat is
Let me get you away from the computer.
so Happy United's 2020 summit was virtual and ended up being in December that
Oh
year,
my
but
God.
we recorded it and it's online. It's on the Happy United website and on YouTube. But uh, Shuma leads a fantastic discussion and then actually has you kind of move off and take, I think it's a Harvard um, uh,
Implicit bias.
implicit, but yeah, thank you. Implicit bias test, and I'll tell you, I think everyone should take an implicit bias test. Like, you will either be surprised that you like predicted yourself perfectly, or you'll be surprised by the fact that your implicit biases are not what you thought they were. So I think it's a learning experience either way. Um,
So Frank, there is a question out, and I think it's a very interesting question
oh
from
yeah.
Brittany Gross, and Brittany says, "I know this assessment is for community health organizations, but like you said, words have meaning. So who do you think should utilize this tool, and maybe who would not benefit from this tool? Sorry if this seems obvious or you said this and I missed it. What are your thoughts around that?"
No, I don't think I think that's a fantastic question. Yeah, because sometimes you might be like anyone can use it, but it's actually geared for a better like one piece or the other. So we definitely, I think if you look at this, the bias will be towards community health and the way that we think about and approach community health. That being said, I will say that I think that if you are like an organization that is focused on helping people in some way, health or otherwise, and are concerned about or curious about and making sure you're doing it in an equitable way, some, if not all of this tool will be helpful.
Mhm.
I think that because we were like so methodical in trying to keep it flexible and really letting the individual user define certain pieces, that
Mhm.
it does allow you to get out of the health space, but it really does look at like you have the people that you're trying to serve being part of the process, and it's really asking those type of questions. And so if you're serving a community where you can't actually like get that input or just a community you're not engaged with, this will probably not be the best tool, but just for most of our partners who are very much engaged with like on the ground work and communication with the community, I think this would be useful, health or otherwise.
Mhm.
What about you, Chioma?
Yeah, no, I mean, I agree. And I think that, it's important that your organization is willing to do the work. If your organization is already in conversation about this and already thinking about this, then I think the tool will be right for you. If your leader, if you maybe as a middle manager, as a frontline worker, and your leadership is not ready, then this tool would not be the mechanism. Because this tool is really for folks who are clear about equity as being a framework, and want to deepen their work according to that,
Yeah.
right?
That being said, Chioma, though, I will say there I think might be a use case though if like you think your organization should be doing more on health
Mhm.
equity and don't know how to show that to your leader. This,
Mhm.
doing a self-assessment like this on a program or organization and then going to your leader and being like, hey, you like are we maybe like you show that they have a opportunity to improve in that space, and so you might be able to use it to
Mhm.
like to spark change, although it'll be you'll probably be
Oh,
seeing a lot of developing and undeveloped in that
mhm,
instance.
mhm. Yeah, I could definitely see that. I could definitely see that. Mhm.
Thank you for that question. Well, we
Mhm.
are at a quarter till, and we do try to wrap these at 45, so that folks are able to fit these in through other ones. I'm glad you were able to stick with us through Q&A, Chioma, and
Mhm.
really appreciate all your leadership on the building of this tool and taking the time
Thank you.
to talk about it with us today. And for those of you who are attending, really appreciate you taking the time as well. We are very excited and proud of this. Let me just share my screen again, 1 second. So
Mhm.
we are excited and proud of this. Please do use it and let us know, like good, bad, ugly. Just we would love to hear feedback on it. It is now live. It's now public. Once it's on the internet, it's there forever. Our next Be Informed session's just under 2 months. It'll be Tuesday, July 13th. Sorry, 15th. I can't read. Additionally, though, wanted to say my colleague Shreya and I next week are doing a About the Basics webinar, looking at raising awareness, screening, vaccination, and resources. Just heard folks wanted to get some of that basic info, a refresher on some of that basic info. So doing that as we head into the summer. So thank you all for joining. Thank you again for our lovely speaker, Chioma, and we will see you all in July.
Thank you. Thank you everyone for joining. Thank you for having me, Frank.
Yeah, thank you, Chioma. Have a great one.
You too. Bye.